Let's be real. When you're in nursing school or just living on a budget, finding high quality clothes that don't feel budget can be a challenge. That's why I'm so excited about Quince. As I start transitioning my closet for fall, I've been looking for easy, affordable staples I can wear on repeat, and Quince totally delivers. Their styles are elevated but simple. Think cozy sweaters, washable silk tops, classic jeans, all at prices that actually make sense. Right now, I've got my eye on the lightweight cotton cashmere link stitch dolman sweater. It's so cute. And the 100% organic cotton boyfriend crew sweater. Both are under $40. That's seriously unheard of for pieces of this quality. Quince keeps prices low by cutting out the middlemen, and they only partner with factories that use ethical and responsible practices. Elevate your fall wardrobe essentials with Quince. Go to quince.com/nursemo for free shipping on your order and 365-day returns. That's QUINCE.com/nursemo to get free shipping and 365-day returns. Quince.com/nursemo. Hello there, I'm Nurse Mo, and welcome to Mo's Monday Minute, a shorty episode of the Straight A Nursing Podcast where I share a quick tip you can start using to improve your practice or habits right away. For more in-depth topics, check out the episodes I release on Thursdays. So in this episode, I'm sharing a tip for new nursing students. So if you're a new student, put your ears on, and you're going to be doing some care plan work for your clinical days, whether you do that before you go to clinical, whether you do that after you go to clinical, whatever your instructors call it, you're doing care plan work. And as a clinical instructor, when I was doing that job, one of the things that I noticed students really struggled with, because they're new, you don't know yet, is filling out your medication worksheets or your med sheets or whatever your instructor calls it. So I'm going to talk through kind of an approach to that to help you so that hopefully you don't struggle as much. You can kind of start a little bit ahead when you're doing your clinical homework. So the key things that your instructors want to see when you're filling out your med worksheets, and they'll have different formats for you to follow. It doesn't really matter what format they want you to follow. The overall gist of this is that they want to see that you understand the medication overall, that you know what the safe dose range is, that you know why. That's a big one. Why the patient is getting it. You know some key adverse effects, and you know your priority nursing assessments, your monitoring, labs you would follow, things like that. So when you're doing this med worksheet, you're going to be using some kind of a drug guide as your reference. I could always tell when a student would just grab random bits of information from the drug guide and throw them into the med worksheet, because it wouldn't always be applicable to their patient. So it's very important that you personalize your med workup to your patient and why your patient is getting it, what side effects your patient is experiencing or at risk for, just making it very patient-centered, okay? Not just grabbing random information from the drug guide. So one of the things you'll want to add is the drug name. I like to include both the generic and the brand name just because patients will often call drugs by the brand name, and it's just important to be able to understand what they're talking about. Like if they're taking levothyroxine, they might not call it levothyroxine. They might call it Synthroid or something like apixaban. Your patient most likely is calling that Eliquis, right? So I like to include both the generic and the brand name. Then you're probably going to be asked to indicate the dose range. This is so that you have a general idea of what is safe, because nurses are right at the front lines, correct? And a lot of times med errors are caught because a nurse noticed, hey, this really seems like a lot of medication. Then they reach out to the physician and they realize, oh yeah, that was an error. Thank you for catching that. and everything's fine, right? So paying attention to dose range, also pay attention to the units. I remember a student once had in their med workup that a patient was going to be getting 50 milligrams of fentanyl. And I was like, whoa, we're not going to kill anybody here today. It's actually micrograms of fentanyl. So just paying attention to the number and the units. And then here is a big one. This is the why. This is where a lot of students struggled with the why. So when you look up a medication, your drug guide is going to tell you all the disease conditions that this medication is used for. This is fabulous as background knowledge, and a lot of times it will line up with what's going on with your patient. But I want to warn you not to just choose a couple things at random. Don't just pick the first two in the list and be like, okay, cool. Okay. You want to know why your patient is getting the medication. And here's the tricky part. Sometimes medications are given off-label, and sometimes they are given prophylactically. So I'll give you two examples of that. So looking at a med that is often given off-label, and when we say off-label, we mean that it's being given for something that it's not technically indicated for, but it works really well for this other thing. So gabapentin, which is an anti-seizure medication, I don't think I've ever given it to a patient who has a seizure disorder. It is many, many, many times used for neuropathic pain. So let's say you've got your patient in the hospital, they have type 1 diabetes, and they have diabetic peripheral neuropathy, and you put on your med worksheet that they're getting gabapentin, and it's for seizures. And your patient does not have a history of seizures. That means you don't understand why your patient is getting it. So you always want to personalize your medication sheet to your patient and their medical history. And sometimes you might not understand why they're getting it. And we'll talk about that in just a moment, because the other thing I want to mention is that sometimes the drug is given prophylactically to prevent something. So many times, most of the time, patients would be getting some kind of acid reducer, like a proton pump inhibitor or H2 receptor blocker, like Pepcid, famotidine, something like that. And the student would often write, it's for GERD. It's for acid reflux. And I'd be like, well, does the patient have acid reflux? Well, no. Well, then why are they getting it? And this is where you would have to know that they're getting it prophylactically to prevent the formation of gastric ulcers. And how do you know this? Like, how would you ever know this if you didn't have a ton of experience at the bedside? Here's what I'm going to suggest that you do, is you want to, first off, read the patient's medical history. Look in the chart, see what their past medical history is. Look at that H&P, which is that initial note that the doctor writes, the history and physical. A lot of times it'll say, here's the meds the patient is taking and for what conditions. And then another thing to look at is the progress note from the physician. Look at that every day that you are in clinical, because that's going to basically say, the doctor's going to be like, here's my plan. They're going to be prescribed this, this, and this for this reason. They're going to be getting this for this reason. They're going to be getting Pepcid to prevent gastric ulcers. They're going to be getting gabapentin for their neuropathy. They're going to be getting metoprolol for their atrial fibrillation and rate control. Whereas you might see metoprolol and think, oh, it's a hypertension med. They must have hypertension. But if they don't, then you haven't connected it to why your patient is getting it. Okay, so that is the why. You really want to tie that into your patient. Now, let's say sometimes you look and you're like, I have no idea why they're getting this medication. Sometimes it might be a home med that they take, and they might be taking that for something that maybe for some reason got missed in the past medical history, or it's an off-label med, something like that. You know what I do? Ask the patient, be like, hey, Bob, why are you taking, I see that you take such and such. What do you take that for? And Bob will be more than happy most times to tell you all about why he takes a certain medication, because patients really like being heard. They like discussing their history with you because it makes them feel included. And the more you know, the better care you can take of Bob. And we all want that. So now let's talk about adverse effects. You will be asked to include some adverse effects on your medication worksheet. So what I would recommend here is, again, you're going to your drug guide. Don't just pick the first two in the list. I could always tell when students did that. I want you to find the most common adverse effects and the things that your patient is most likely to experience, because you're going to be teaching them about this medication, right? So you want to be able to explain, oh, you might experience some nausea with this medication, or maybe a little diarrhea. Let us know if that happens. We'll see what we can do to help relieve that. So you want to let them know some common adverse effects that they might experience, not the uncommon ones. Oh, this one can cause Stevens-Johnson syndrome and anaphylaxis. So let us know if you start feeling like you're going to die any minute. You wouldn't say that, right? You would terrify the patient, first off. And secondly, that's not likely to happen. It can happen, obviously, but it's not likely. You want to make sure that they understand common adverse effects. Does that mean you're not watching for things like anaphylaxis or Stevens-Johnson's syndrome? Of course not. You're still watching for those things, but it wouldn't necessarily be what you would be talking to your patient about. So looking at the adverse effects, most times in your drug guide, they're going to be indicated if they're the most common, underlined or italicized or what have you. Or if you happen to do your care plan and your med worksheet after your clinical day, look and see, did your patient have any side effects to this medication? Include those in your med worksheet. If they took an antibiotic and then had diarrhea, well then yeah, that would definitely be an adverse effect or side effect that you would list out. Okay, so that is how you're going to approach that component of your med worksheet. And then the other element that students really, really struggled with, and this is just because when you're brand new, you just don't know a lot yet. So you're really kind of building as you go. And when you're brand new, this part is really hard. And this is your key nursing assessments and monitoring and those things that you're watching for and the labs that you want to take a look at. So I want you to look at this and just try to pause for a moment and think, okay, I'm giving this med. What data do I need? What data do I need before giving the med? Because sometimes you do need some data before giving the med to make sure that it is safe. And then what data do you need after giving the med? So for example, let's say you are giving an opioid. Your patient's got 8 out of 10 pain. They're going to get an oxycodone. Or better yet, how about a combo drug, Norco, which is hydrocodone and acetaminophen? What kinds of things do you want to know before giving this medication? Well, we want to know their pain level to make sure that we give the appropriate dose, because many times it'll be tiered. If the pain is really severe, maybe they get 2 Norco. If the pain is mild, maybe they get 1. I also want to know how sedated they are. If they've been getting a lot of opioids and they're pretty sedated, I'm probably not going to give them more and sedate them further. If they are sedated or their respiratory drive is affected, you notice they're breathing really shallow, kind of slow. I'd want to know their respiratory rate, their oxygen saturation level, and their blood pressure, because opioids can cause a drop in blood pressure. And in the case of something like Norco, which is a combo of hydrocodone and acetaminophen, I want to know how much acetaminophen they've had today, because there is a max amount of acetaminophen that a patient can have in a 24-hour period. So a lot of data I want to know before I give that medication. And then after giving the medication, I want to know, hey, did it work? That's the key thing here. And that's a lot of the times what students would miss is, how do you know the med has been effective? That's one of the key things you want to assess afterwards. In this case, I'm assessing their pain level. Hey, was it effective? I don't know. Let's go ask Bob what his pain level is. Now it's a 4. Yes, the medication worked. I'm also still assessing those things that concern me about opioids: sedation level, respiratory rate, SpO2, depth of respirations, all of those things. So those would be the things that you'd want to be looking at for a patient taking that kind of medication. Let's say I'm giving furosemide, which is a diuretic. For furosemide, I would want my students to understand that they need to be looking at the creatinine before giving this medication, because furosemide can do a number on the kidneys. And if their creatinine spiked up once they started taking this med, I might want to call the doc and be like, hey, Did you notice that the creatinine is, whatever, 2.3? Do we want to continue with the furosemide? And they may say yes. They may say, no, let's hold off on that. Maybe we try something else that maybe isn't as harsh on the kidneys, but we'd want to know the creatinine. Another lab I'm really curious about with furosemide is potassium, both before and after, because if the patient's already got low potassium and you know furosemide, you know that it's going to cause potassium losses. If their potassium is already on the low end and I give this pill or this injection, then guess what? Their potassium is going to fall even more. So I kind of want to know about that because we are going to be looking at potassium replacement for this patient, right? So looking at their potassium level. After we give the furosemide, what are we looking at? How do we know it worked? Well, why did the patient get it? They got it because they needed to get excess fluid off, excess volume off, right? So urine output, how much have they put out? That would be the key thing to know there. I'd also want to keep an eye on their creatinine level and their potassium level because it is going to drop and likely need replacement. If they were, had fluid in their lungs and that's why they were getting it, I'd be listening to their lungs. Hey, did their lungs clear up? Yeah, great. Then the furosemide is working. So another one is heparin. If your patient's getting heparin, which is an anticoagulant, I want to look at their PTT level, which is going to be elevated with heparin dosing. And we do want to elevate it. We want it only elevated to a certain degree. So if it's crazy, crazy high, maybe they're not needing any heparin right now. Maybe we would call the doc and be like, hey, their PTT is crazy high right now. You wouldn't say it like that, obviously. Do you want me to hold the heparin? I would also be looking at their platelet level. If their platelets for some reason drop to like 20,000, given heparin to this patient, I'm going to be definitely making a phone call about that. So looking at those types of things prior to giving the medication, and then also looking at afterwards. You gave the heparin. How do we know it worked? Well, why are they getting the heparin? Were they getting it for DVT prevention? Well, then great. I'm watching for signs of DVT. If they don't have one, guess what? The heparin is working. I'm also looking for excess bleeding because that's one of the things, one of the adverse effects, right? Heparin can cause bleeding, oozing around IV sites, easy bruising. I'm looking for those types of things as well. So does that make sense? When you're looking at filling out your med worksheet, let's say it's an antibiotic, you're looking at their white blood cell count to see if it's trending down, you're taking their temperature, you're monitoring for signs of infection. All those things are going to be your key nursing assessments when you are evaluating, has this drug worked as affected and has the patient suffered any adverse or dangerous effects from it. So use these tips to wow your instructor when you're filling out your med worksheets. I hope that helps you. And if you're heading into nursing school soon, I want you to know you can do this. You are smart, you are capable, you are strong, you are resilient, you are resourceful. All right, I will see you again soon. Bye for now. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com.
I'm Chris Hadfield. I'm an astronaut, an author, a citizen of planet Earth. Join me for a 6-part journey into the systems that power the world. Real conversations with real people who are shaping the future of energy. No politics, no empty talk, just solutions-focused conversations on the challenges we must overcome and the possibilities that lie ahead. This is On Energy.
Listen wherever you get your podcasts.